Thank you, everyone. This is exciting to have you all with us today for our Hot Topics webinar. While the last few people are joining, I just want to again point out on screen you have information about our upcoming annual conference, 39th annual conference. So next year is going to be a big deal. But our theme this year is telling the story strategies for improving healthcare data. So hopefully that you've all had a chance to check out the agenda and get yourselves registered for that. If not, now would be a good time to kind of take a look at that. So again, this is a part of our NAHDO's Hot Topics webinar series. Today's topic is going to be the Hospital Data Initiative. So we'll talk about that in just a second. But our Hot Topics webinar series is every couple of months, we pick a topic that we think is kind of ripe for discussion. And we want to bring that to the forefront, make sure that everybody's aware of what's going on in the health data organization world. This month, again, we're going to be focusing on hospital data. While that's happening, getting ready to go, just for those of you who are not familiar, I think by now everybody is familiar, NAHDO is a national not-profit membership and educational association dedicated to improving healthcare data collection and use. And we're going to be focusing specifically on those roles today. So NAHDO, as you should be aware, is committed to supporting members who participate in collecting discharge data from hospitals and other facilities. And that includes different types of data, and there's some variation in how the terminology is used, but we're thinking about data on hospitalizations, frequently called hospital discharge data or encounters data or other things, but just think about it as data on hospitalizations. And along with that, emergency department data, so data on people who are visiting emergency departments or ambulatory surgical data. And there are other sort of allied data that go along with that as well. So that is a core part of NAHDO's identity. NAHDO's support for this type of data collection goes all the way back to our founding in 1986. In fact, the reason for NAHDO's existence is due to people wanting and needing support for the collection of hospital data. NAHDO activities have made significant improvements in both the quality and utility of hospital data over that time period. So as I mentioned, we're coming up on 40 years, and so it seems like a long time, but that is something that has been true to our roots and true to our heritage to focus on helping improve the utilization of hospital data. This year, we want to have a special emphasis on adding additional support for the growing needs of hospital discharge data collection and use. In some sense, it's a mature type of data collection. It's been going on for, like I said, almost 40 years. But on the other hand, the complexities and the challenges still exist, and the ability for us to support and assist people is growing year after year. So before we get into the launch of NAHDO's new emphasis on the Hospital Data Initiative, we want to hear about the Massachusetts experience. So the Center for Health Information Analysis is an independent agency and is the steward for Massachusetts health information. And their mission is to promote a more transparent and equitable healthcare system. So we're going to hear today from Kathy Hines, who is the Senior Director of Partner Operations and Data Compliance, and Huong Trieu, who is the Senior Director of Research. So if you'll give me just a second, I'm going to get their slides on screen and we'll be ready to hear their presentation. Okay, Kathy and Huong, I think we are ready. If you can see that on the screen, we're ready to go.
Yes, great. Hello, everyone. Thank you for attending NAHDO's Hot Topic on hospital data. I'm Kathy Hines from CHIA, and I'm being joined today NAHDO asked us to speak for a few minutes to kind of set the stage, to talk a little bit about CHIA's history with hospital discharge data and our association with NAHDO. Next slide, Norm. So a little background on CHIA. We were created by the Acts of 2012 by our legislature to be the hub of healthcare data and analytics. We are a steward of Massachusetts health information. And although CHIA was started in 2012, we have a long history with this data. We have two predecessor agencies, Healthcare Finance and Policy and the Rate Setting Commission prior to that. I've worked at all three. and all three were responsible for this data. I became involved with NAHDO back in the 1990s, the early 1990s, when NAHDO, as Norm mentioned, was a heavy proponent of the hospital discharge data. And at the time, NAHDO and CHIA, then Rate Setting Commission, were working with the federal government, ARC agency, on their healthcare utilization project. Next slide. So as you can see from this slide, our agency is the agency on record to collect, house, distribute, and report on a wide variety of healthcare data. Today, of course, we're going to talk specifically about the hospital discharge data and NAHDO's role in that area. As I just mentioned, my role with NAHDO goes back to the early 1990s, but as Norm mentioned, NAHDO's goes back to 1986. In addition to working with the federal government on ARC and the HCUP utilization project, everything states have experienced with NAHDO, with the all-payer claims data, is on the forefront for NAHDO on hospital data. They have annual conferences. As you can see, we're up to our 39th now, and for sure, APCDs haven't been around that long. They have hosted technical meetings. They've provided assistance on the federal level, not just with the HCUP project. They've provided technical assistance. They've helped states with best practices and data standards. In short, they've been there all along on every step of the way with the hospital discharge data. And today, I think they just are trying to revitalize that a bit, to say we're still here. We're still here to work on that as well as the APCD. Next slide. So I think we all know what the hospital discharge data is. And it varies state to state. I think almost every state collects the inpatient discharge data and the emergency department data, but we diverge a bit from there. Massachusetts also collects observation bed stays, and more recently, we are collecting inpatient stays from behavioral health hospitals. Other states, as Norm mentioned, are collecting ambulatory surgery. Huong's going to talk a little bit about how CHIA uses the hospital data, but I wanted to take a moment just to say how many other entities use this data. Certainly, many state agencies use it, from our Attorney General's office to our Health Policy Commission, our Medicaid division, our Department of Public Health. They all are using this data. The federal government, as I mentioned, ARC, is using this data. We have a myriad of researchers, nonprofits, academics that use the data. The hospitals themselves come to us for data, as well as health plans. How it's used, I've put a few examples up here on this slide, but there are many, many other uses. I'm going to just briefly touch on a couple that are a little near and dear to my heart. The Department of Public Health, which does hundreds of studies using this data, has a data system they call the Pregnancy to Early Life Longitudinal Data System. They've been using our data in that system back to the beginning, 1982. And they just keep adding to it. They don't roll years off, they keep adding to it. And so I think that's really neat that they've got this data that goes back to 82. But what I really think is cool about it is that I'm actually in that database. I gave birth to my children in the late 80s, early 90s. So I'm in that as a maternal record. My daughters are in that as birth records. One of my daughters has had children in Massachusetts, so she's in it as a maternal record. And my grandchildren are in it as birth records. Now it's all de-identified. There's no way anybody's going to know it's me and my family. But I just think it's cool that maternal record X has birth record Y, which turns into maternal record Y with birth records Z1 and Z2. So that's one use of this data. Another one, also near and dear to my heart, is around preventable hospitalizations. My daughter, when she was young, was diagnosed with asthma, and we, as parents do, were up at that doctor's office frequently. We had our nebulizers. And on one particular day, she had a particularly severe asthma attack. We're at the doctor's office, and the doctor comes out and says, a year ago, we would have sent her to the hospital for an inpatient stay. But the state has come out now and said that we should be able to give out nebulizers to patients to prevent them from going to the hospital. Now, the doctor didn't know what I did, so she had no way of knowing how close that was to home for me. But I was the one who was in charge of collecting that data way back then. And my agency, in association with our Medicaid agency, was the one that had done the research that said, if you provide nebulizers, you're going to prevent hospitalizations. So those are my two near and dear to my heart examples. If you go to CHIA's website, you will be able to find a whole bunch, a list of who has requested our data, what they've used the data for. I think there's a list there of some of the published studies. So by all means, feel free to check some of that out. At this point, I'm going to turn it over to Hong, but I do see someone has a hand raised. Norm, should we take questions at this point, or should we wait until the end?
Let's do that. If there's a question for Kathy, it looks like Nancy has a question. So Nancy, go ahead and ask your question for Kathy.
I accidentally hit the wrong button. I was just reacting. I just thought her examples were great.
Thank you, Nancy. Okay, so at this point, I will turn it over to Hong, and she can talk a little bit more about what how CHIA is using this data today. Thank you, everyone.
Thank you, Kathy. Next slide. So I will just talk a little bit about some of the publications and uses CHIA have done with the case-mix databases. I think, as everybody know here, during the pandemic, there was a huge need for data on about hospital capacity. And Kathy's team, she was very modest in not mentioning this yet, is that we started a collection, I should say, her team started a collection of quarterly reporting of like that we get the data from the hospital from the state, our case mix data. And that enabled us to do quite a bit of reporting actually on the acute care utilization trend for our state. I think in December 2020, recognizing this huge data gap and also the need that having this data set available is such a gold mine that we want to start putting this information into the public, into the hands of people who needs to use it. And we started actually with the inpatient data first. And we started with publishing a baseline static report of covering several years of data to provide basically what is the current state in terms of acute care utilization to provide a baseline pre-pandemic. And we started with, like I said, with the inpatient, then we did it with emergency data, and then we did it with observation stay. And we provided that in a static report format where we look at acute care hospitalization trend by hospital, patient, and visit characteristics. And then I would say then we moved into, because of the aspects that we have quarterly submissions from the hospital with this data, then we had started the interactive quarterly dashboards from each of these databases. But to note is that the interactive dashboard are based on preliminary data, because we do give hospitals a period of time to resubmit or things that we found that they could do. So So that's to let you know about a little bit of that. Next slide. So to dive in a little deeper in what do we actually report on, and the interactive dashboard are updated at a quarterly basis. So we just had our update in August, and we covered right now on our website data from October 2018 through March of 2024. And we will be having another update of quarterly releases in November of this year, and that will cover the data through June of this year. So just a little bit of flavor in terms of what are the key metrics that we look at across all these three data set is about total volume, average length of stay, total care days, and for the ED, because there is a aspect of excess length of stay, we provide several thresholds of hours that people could look at. Across, then these measures are cut by patient characteristics, hospital level characteristics, as well as discharge level characteristics that cover then diagnoses and procedures and such that are available in this data set. Next slide. Next, I do want to talk a little bit about, aside from overall utilization trend that we report on from the hospital databases, is that we actually do our hospital readmissions work using the case mix. At CHIA, I would say since 2015, we have started reporting on adult readmissions, hospital-wide readmission. We adapted the CMS methodology for unplanned readmission and using the case mix. So in a sense, our measure is truly an all-payer mix because of that you have self-pay in there that you wouldn't get otherwise. And then we also then in 2023 also adapted a methodology to use to report on the pediatric population. And for both, for the adult readmissions, we do an annual update every year since 2015 to track the readmissions rate in our state. And this is all using the case mix data. Next slide. And I guess to note is that in Massachusetts, the case mix data is truly a great source to look at race ethnicity. And it, in terms of the data that we checked across all three data sets, it's very complete, I would say, and to a large extent, it's very good. And so we have used the race ethnicity variable from this data set to look at hospital utilization in Massachusetts. And then we started with also then an assessment using this data set to look at all the utilization trends and metrics that we can do with the case mix data. And we published a baseline report again in 23. And I would say that this is an ongoing project in terms of that right now, the element of equity, especially around race ethnicity, is being woven into all of the reporting in the utilization and the readmission reporting that we do with the case mix. And I think this concludes our presentation on how CHIA is currently using the case mix data.
Thank you, Kathy and Hong. Do we have any questions for them while we're adjusting back to our other presentation? Don't see any hands up, but if you have any questions, we will have time at the end for sure to come back to that. So let me kind of leverage what Kathy was mentioning at the beginning. NAHDO, again, this is part of our heritage, it's part of what we've done, but we want to reinvigorate the conversation about hospital data among our members and especially among those who have been collecting hospital data. This new initiative is going to help us add value to our current members by supporting those systems, and the members could include anybody that's involved in the hospital data in any way, whether you're a data program, whether you're a support system, or whether you're a data user. we have identified 3 main areas of focus, and I'll give you more detail about each one of these: the hospital data forum, the creation of additional educational materials, and then increased collaboration with ARC and the HCUP project. So the hospital data forum, the purpose of this is to facilitate sharing of ideas and networking. So it's a forum, it's a true forum. It's a place for people to come get together and to talk with each other about what's going on and what's happening in their world and help each other. So we did in-person meetings in 2023 and 2024 in Boston and New Orleans, and it was fantastic. We had a lot of engagement, a lot of interaction. But one general takeaway from those discussions was that doing this once a year is not enough. And also doing it in person leaves out the people who can't travel. So we are moving the hospital data forum to a new quarterly schedule. So starting November 21st, and again, we want you to save that date, put it on your calendar. That will be our first quarterly meeting of the new cycle. Then we will have quarterly meetings in February, May, and August on that annual cycle. The main meeting will be at our in-person event, so we would hope that people would have that also on their calendar the first week of May to show up to our in-person event to talk about hospital data. Each of those meetings has a similar format. It will be a short presentation on a topic of some interest to the whole group, followed by interaction. So people can ask questions that others can answer. They can share best practice and learning. They can highlight successes or challenges, anything that kind of helps generate that dialogue and support as a team working on this data issue. The second element of our new hospital data initiative is the production of educational materials. One of the things that we heard at our last meeting in New Orleans was that there is a lack of training or guidance for people who are new to hospital discharge data. So you are all hiring people on a regular basis, and they walk in on day one, and they don't really know what a hospital claim looks like. So they don't know phrases like UBO4 or DRG. Those things are kind of new to them. So what we would like to do, and what we're going to plan on doing, is with the help of those of you who are experts in this field, to create a short explainer video or some kind of a presentation that could be used by any of our members to orient people who are new to hospital discharge data. We anticipate having that published and ready to go by February of 2025, which would coincide with the February meeting of the Hospital Data Forum. If you're interested in helping to create that video or presentation, let us know, and we'll be happy to have the support in any way that we can. Following up on that, we want to create additional materials that cover topics related to hospital discharge data, such as how the data are created, what are the standards involved, how are data collected and managed, how are they being used to benefit the public and the industry. But those materials and specific topics to discuss will come out of our conversations with the Hospital Data Forum. So we're going to wait until we get a chance to meet together so people can inform that discussion about what's really useful to them. The last thing we want to do is spend a bunch of time and resources creating materials that no one is going to use. So we want to make sure that we're being responsive and reactive and ready to go instead of just making stuff up on our own. The last leg of our 3-phase initiative is the interface with the HCUP program. Kathy mentioned this. We have been around as long as HCUP has been around as an organization, and we've had great partnerships over the years. So we want to continue to develop that relationship even further. And we've had conversations with the leaders at ARC and at the HCUP program, and we have their commitment to work with us to make this happen. We will continue to identify roles and opportunities. What is the role of the HCUP Partners Program? What is the role of NAHDO? How do those things collaborate? How do we coordinate to make sure that we are all providing the support to those working in hospital data space? We expect the relationship to continue to evolve over time, especially as we get feedback from those in the Hospital Data Forum to let us know what are their needs, what are their ideas, what are the ways that we can do a better job to coordinate with our federal partners. Some ideas that we've already identified would be hosting opportunities to meet with ARC officials at in-person meetings or virtual events. We've had ARC officials both in New Orleans and in Boston, our last 2 meetings, and a lot of people have commented how it's really nice to be able to get to meet them in person, put in a face to a name, and be able to discuss questions that they've always had and be able to make those connections and continue to create those opportunities. On the other side of the coin, we want to increase NAHDO's participation in the HCUP partner meetings. We feel like we, both as an organization and our members, have a lot to say and contribute in those partner meetings. And so we're looking for ways that we can participate more fully in those partner meetings. So with that, we're going to take some time for questions. Anybody have any questions for Kathy or Hong or me about NAHDO's emphasis on hospital data, either historic or our forward-looking view with the Hospital Data Initiative? I don't see anything right off the bat, so I would like to just ask a question for Kathy or Hong, whichever you would like to answer this. What are some of the ways that you can see additional support or needs for the hospital data forum or our other efforts? That how could that benefit you as workers in the hospital data space?
Well, I do think, as Hong had mentioned, we're trying to weave health equity into everything we do at this point, and that's somewhat new, I guess I would say. So I think hearing what other states are doing and other ideas on how best to do that would be wonderful. I think also there's been integration with the APCDs. And so hearing some of the approaches states have taken to weave those two databases together would also be interesting. Hong, do you have thoughts?
I think Kathy, you kind of cover that for us. I think an aspect that is kind of like always thinking about, the non-hospital space, but then, but I think that's a much bigger question that I don't think is in the scope.
Great. Thank you both.
Another idea also is other hospital databases that we might not be collecting. Most states, if not all states, are collecting the inpatient discharge and the emergency department. We haven't gotten into the ambulatory space yet. I don't think many states have gotten into the behavioral health inpatient areas that we have. So kind of getting an overview of what states are collecting what and how we can help each other with those data collections.
Oh, very good. That's very interesting. One of the things that I would be interested in, and again, this is sort of our role, is that we have a lot of states who are collecting this hospital data who don't show up to meetings like this one or don't participate regularly, and finding ways to reach out to bridge those gaps. They're out there. We know they're working on things, but it seems that they're maybe operating off channel, if you will, and finding friends who can say, hey, why don't you come and participate in this and be part of the conversation? So that's another area that I think is exciting for us, is being able to reestablish some of those connections that have gotten lost over the years. Okay, well, that I don't see. Oh, we do have a question. So let's see who this is. This is Sylvia Hobbs. Sylvia, go ahead and take yourself off mute and ask your question.
Not so much a question, but just a comment in terms of your partnership with HCUP and even the states and working with each other. Data users tend to be confused about whether or not they should use the APCD or the case mix data when they're doing inpatient ED or outpatient observation stay analysis. And it might be worthwhile just in terms of having a document, a nationwide document even, to help people understand the magnitude of difference in terms of payers missing and self-insured, so that perhaps that can encourage more payers to submit data to APCDs and have people understand the value of the case mix data in terms of being population based. But I just wanted to compliment Kathy Hines on giving a powerful example of how the use of the data influence a regulatory change with regards to the asthma medication. That was very powerful.
Thank you, Sylvia. I think that is a great point that you make. There isn't a lot of understanding by data users and even policymakers, for that matter, about the difference between what you can do or what you can find in the hospital discharge database versus the all-payer claims database. Each has strengths and weaknesses, and we who have worked with both of them understand those very well. but it seems like that knowledge isn't widely shared, and maybe that's something that we could help get out in front of people's understanding. What's the difference? If you're, what can each be used for? What are the strengths and weaknesses of each of those databases? A good observation. Any other questions? If not, I am going to thank everybody for your participation. Thank you, Kathy. Thank you, Hong, for being with us today. And we look forward to seeing you at our annual conference coming up. And there's the screen again in November. Actually, the first session is October 30th, was one of our pre-sessions. Make sure that you get registered so you have full opportunity to attend all of those sessions. And we will have further conversations about data quality, data issues, and lots of other things related to both hospital and APCD data. So again, thank you for your time, and we'll see you again very soon.